Hi, it's Joel Wood from the Council of Insurance Agents and Brokers. In almost 19 years that I've been lobbying for this trade association, I've always thought that the smartest political analyst is Charlie Cook of the Cook Political Report. Charlie and I were together down in New Orleans speaking at one of our major member firms a couple of weeks ago, and somebody asked him about Obama's re-election prospects. And what he said was, look, take the Republicans out of it, take the Democrats out of it. It's all about those independents who went in a big way for Obama in 2008. And right now, those independents are polling an approval rating for the president only between 35 and 39%. You combine that with a really, really rough economy. He says on paper it's virtually impossible to envision how Obama gets reelected. But he also said it's like the old Henny Youngman joke. How's your wife? Compared to what? Putting aside who might be able to defeat Obama, let's assume a Republican sweep next year. Let's assume they maintain control of the House of Representatives, they regain control of the Senate, which I think is likely, and let's assume that a Republican is elected president. What's this going to mean on the key insurance issue of health care reform, the Affordable Care Act? Certainly Republicans are running in a big way on a pledge to repeal and replace the legislation, but a lot of it, particularly those aspects that have already been signed into law and have already taken effect, as opposed to those provisions that will take effect over time starting in 2014. A lot of those provisions are pretty popular. The preventive care provisions, which we support, the market reforms, pre-existing conditions restrictions for kids, the slacker provision even. That's unlikely to change. Even on the more parochial front, the minimum medical loss ratio issue, which we've been working very, very hard to exclude agent broker compensation from the MLR calculation. The General Accountability Office released a report to Congress only a couple of weeks ago saying that the overwhelming majority of current plans do fit within that 80 to 85% MLR. Certainly that doesn't mean that there isn't a huge squeeze on agent broker compensation, and especially as you go into the smaller groups and in the individual health marketplace, it's a lot of displacement going on there. But if the MLRs maintain themselves consistent with what those numbers are in the law, it's going to be very difficult if we don't politically take care of this in the course of the next year for them to be completely eliminated moving forward. The biggest issue certainly for the construct of the Affordable Care Act is the development of the exchanges. Much in the papers recently about how many states are lagging behind others in the development of exchanges. Many states even very recalcitrant in terms of being willing to establish these exchanges. If you remove the individual mandate, the employer mandate, and the massive subsidies that go up to 400% of the poverty line for those who participate in the exchanges, it is very, very difficult to envision how the exchanges would be anything like what the Obama administration had envisioned. Nonetheless, that development on the exchanges continues in many, many jurisdictions, and we could wind up with a system in many states that are very similar to the Utah type of electronic, internet-based comparison shopping for plans, as opposed to a much more pervasive Massachusetts-style plan. Republicans have a lot of different notions about health reform, and they're going to have make some big, big decisions as to how far philosophically they want to remain committed to this notion of moving away from employer-sponsored care into a purist, consumer-driven type of approach. It's going to be a fascinating debate to watch. We've got our game face on. We've got our council pack tie on for the course of the next year or so, and we will keep you posted. Thanks.